I mean, I'm very acutely aware of environmental exposure and how that impacts your health. Exposures aren't necessarily just going to affect one organ. It's only natural that it could have impact anywhere and everywhere.
Over the last few years, we've studied the effects of air pollution, and in particular PM 2.5, on dementia and related outcomes. So these particles are so small that they can get really deep into your body and cause damage. So for example, PM 2.5 particles, when you inhale these particles, they get into your respiratory system, they get into your lungs, they even enter your alveoli, and from there they can enter your bloodstream.
So in this particular major grant that's supported by both NIH and NIA, we are particularly looking at the components of PM2.5. We are trying to look at and assessing the specific levels of different metals and metalloids in these different biological metrics, including blood, spinal fluid, and brain tissues.
In our study, we will cover participants from 3 different study populations, which cover a broad range in terms of age and also disease status. We also will use data from a brain bank. We have the opportunity to really get access to blood samples, CSF samples, which are cerebrospinal fluid samples, because the CSF is really directly linked to our brain.
And in the future, other scientists will have a much better understanding of what are those toxic components in the PM2.5 that are responsible for increased risk of Alzheimer's diseases.
I mean, certainly learning more about Alzheimer's and what might be the natural history or the things that might make you have a higher propensity is very important, and not just to my generation, certainly, probably, but to the future generations.